Welcome to my podcast. Good morning. This news item describes here is related to childhood obesity. The title is New Childhood Obesity Guideline. Release, release here is what parents and caregivers need to know about Michael Pricks published, which he also published on Monday, January 9th, 2023. So the source of this publication is from ABC 11 News. The news reporter states that there are many factors that plays out in school when the district is choosing healthy lifestyle for students. He states that they want a more holistic approach looking at childhood obesity. He states that the school sees childhood obesity as a multifactored issue that needs to be addressed. The school calls for early action in order to prevent long-term health problems. The school offered positive lifestyle pattern by allowing students practice the skill by themselves where they grow fruits and vegetables. The school offers virtual garden focusing on produce and whole grain. They give balanced meal suggestion and easy recipe. The reporter also reiterated the health problem of childhood obesity, which includes type 2 diabetes, hypertension, and depression. They state that previous guidelines from AAP was switched from watchful waiting to an early intervention towards curbing obesity. Duke's pediatricians state that there are disparities in access for effective treatment for obesity for years, which is why they advocated for treatment such as intensive behavior counseling, medication, and bariatric surgery with insurance. The advocates want school meal to be balanced with a view to helping in fighting childhood obesity. The reporter states that legislative body will be more focused in increasing school funding for health meal at schools. The role for choosing this news item. I chose this topic, childhood obesity, because it is a serious health problem and has reached a peak level in the United States, which has affected about 14.7 million children and adolescents. Many factors can contribute to excessive weight gain, including behavior, genetics, and taking certain medication. Obesity related conditions include high blood pressure, high cholesterol, and type 2 diabetes. Breathing problems such as asthma and sleep apnea and joint problem is also inclusive. In this news, risk factors and protective factors were addressed but briefly. Other risk factors for childhood obesity include genetics, basal metabolic rate, and metabolism, poor diet, government and social policies, dietary factors, fast food consumption, activity levels, environmental factors, social cultural factors, family factors. The protective factors for childhood obesity include choosing healthier food like grains, fruits, vegetable, healthy fat and protein source, and beverages, limiting unhealthy foods such as potatoes, refined grains, and sweet red meat, and processed meat, and sugary drinks, improving sleep, increasing physical activity, limiting television time, screen time, and other seat time. There are many partnerships that has been established to tackle childhood obesity in the United States. The Action for Healthy Kids focus on the child obesity epidemics. This organization is dedicated to bringing more physical activities and nutritional lessons to school in the United States. It offers uh, school with grain, volunteers, and information needed to start and expand healthy eating program and physical education. American Obesity Foundation AOF is another agency that fights against obesity epidemic in the underserved and most vulnerable neighborhood. American Obesity Foundation promotes health nutrition options at home, school, work, house of worship, and the community as a whole by breaking down mental, emotional, and physical challenges in underserved communities. The intervention that most commonly applied to this situation presents in this news item is advocacy, and it's community focused. Advocacy is the act of promoting and protecting the health of individual and community by collaborating with relevant stakeholders, facilitating access to health and social services, and actively engaging in key decision makings to support and enact policies to improve community health outcome. This is the end of my news podcast and I hope you enjoyed it. Thank you.